I saw some recent information just as things are continuing to evolve. You've got some great use cases that have been proved out, as you just mentioned, on the missions, the ADT and awareness, ED kind of drivers. Some of the other areas, kind of progression going forward. What are some of the key areas that you kind of foresee in the future as great use cases that could drive some good outcomes?
Try to focus as a unifying message is around the Medicaid spending. Nobody wants to spend that. That's a third of the state budget in Texas.
Wow.
It's also, that's opportunities, mostly kids and moms in Texas. So, that aligns legislatively, that aligns with hospitals and physicians, it aligns with communities is to how do we, not by taking people off of Medicaid, but making that care more efficient and reducing those poor outcomes. So we're working in San Antonio, recently in Tarrant County. I was just up there last week. We were talking about maternal health and how do we, again, just as the interoperability piece of that. So it takes the community, but how do we reduce the risk of preeclampsia? How do we reduce the risk of premature births? All expensive outcomes, not good for babies and mom either. But that takes a whole lot of care coordination in order to do that, for which you need interoperability. So sort of we're sitting down with each of these communities and what are you trying to do? What needle are you trying to move? Where's the data need to go to make that happen? And how can we, as health information exchange, industry, help you achieve those goals? So that's where I think where I'm really trying to focus in multiple ways is on maternal health and kid outcomes.
Excellent. Yeah, that would be wonderful,
And I would
both
like to,
from a family perspective as
right,
well as
totally. No,
a
no, no.
cost perspective. I mean, it's huge. Yeah.
It seems to align in a lot of ways. And, if we could save, so say it's $47 billion a year, the budget in Texas, if we could save 10% of that in a few communities and then say we could do that across the whole state, potentially, that
Mhm.
turns into big numbers. If there's a cost sharing in that, that could help drive the revenue for health information exchange infrastructure. But I think, as I said at the beginning, we got to get down to real ROI. Hey, you do this, saves money, improves outcomes.
Definitely about the ROI.